everybody, I'm Elisa. We're back and we're talking about the respiratory system. We're going to continue on with just kind of a brief description of the pharynx. So, the pharynx is really kind of like it's this area that connects your mouth and your nose. Oh, sorry, that's your mouth, that's your nose. And it connects it into just like getting ready for your airway. It's really like the back of your top of your throat, okay? So like if you have allergies sometimes like I am like this is where my allergies are. My allergies are always in the pharynx. It's like going to be this area that gets inflamed, right? So that's the pharynx. The components are the nasopharynx, that's the part that connects to the nose. The oropharynx, that is to the oral cavity, aka mouth, and the laryngopharynx, which is going to be right, well, actually, right down here, where where the larynx uh, connects to the pharynx. Okay, there you go. All right, so pharynx. Let's see, come here. Okay. The pharynx is the throat, right? It's a very cool word for that. And it is a semi-muscular funnel, and it's, not huge. It's about 5 inches in like an adult, like male or larger size woman. And there's the three regions. We talked about the nasopharynx. This is going to be the one that has, like, I don't know if you probably don't know this yet, but the thing about the nose is like, so here's the nasal cavity right here, right? And so the nasal cavity, the mouth, the oral cavity, right? Here's like oral cavity and then nasal and then auditory. Like these are your ear tubes are all actually like kind of the singular structure that wants to be connected and then they open up. And so that's why when you have a kiddo, right? Like a cute little kiddo here, I guess, that has like ear infections, like, oh no, I don't know what that is. That is not a kid. Holy smokes. Can I just clear those pen markings? All right. Baby, I guess, right? It has a nose, then a mouth, and then, oh my gosh, what a mess. Okay, but anyway, point is ear, right? Here's the ear. Has ear infections all the time? Like it's because their ear tubes are really straight and they're connected to this nasal cavity. And so when bacteria or allergies or sometimes even teeth coming in, um, cause them to get inflamed, they actually close up and cause these bacteria. And then this, you don't have a hole to the outside of your ear. There's an eardrum there, right, blocking that off. And so that's how the ear infection situation happens so often in younger children. So just keep that in, right? So they're going to be receiving those auditory tubes. The oropharynx is just the space, really, like in the back of the mouth. Like here's your mouth, right? And so it's coming back here where your hangy ball, is going to be down here, right about to the top of the epiglottis, okay? It contains like the tonsils, right? So the palatine tonsils as well. So that's an important part of your immune system. And then the laryngopharynx is everything from like the epiglottis down to your trachea, and it's like really where all that cartilage starts having that kind of ridged looking pattern, right? So the nasopharynx only passes air through and no food or anything like that, and it's over the pseudostratified columnar epithelium, so it's producing mucus and it's able to kind of pull out chemo sensation, so olfaction. Oropharynx is going to be food, along with the laryngopharynx. It's going to pretty much just pass air, but like oropharynx is food down to the esophagus and drink. So when you kind of like all of a sudden it feels like it goes down the wrong pipe, that would be what happens there. Then the muscles of the pharynx, especially the larynx, are going to assist in swallowing as well as speech. So the larynx is the voice box. Okay, it is it's kind of, you saw we have this cricoid cartilage, right, going through the trachea for stability, right? And so the larynx has got this like massive amount of cartilage right there, right? And so it's inside the chamber. If you were looking down, it has like some special kind of components to it, right? And this is like where air would flow through. And so its primary function is to keep food and drink out of the airway. Yeah, but we use it for a lot of um, what we call like phonation. We're making sound, right? It's the voice box. The epiglottis itself is just this like, it's like the lid on the garbage can, and it keeps things from going into the trachea, and it keeps things going straight down into the esophagus like water, like food, and all that good stuff. Um, right. So there are 9 types of cartilages that make up the framework of the larynx. You do not have to know all of them, but I'm going to just kind of really quickly go through them. The one that is the most tippy top, most superior is the epiglottic cartilage. The next one actually supports a very important gland, the thyroid gland. So this is the thyroid cartilage. It forms your Adam's apple, right, in your throat. Okay, that little lump you can kind of feel. Um, Cricoid cartilage is going to be those rings that form after we're, starting to turn into the trachea for like nice keeping it open, right? Keeping that airway open as opposed to the esophagus, which actually collapses on itself when it's not in use too much. Here's a really nice representation of that. So as you can imagine, here is the thyroid cartilage, right? So that's the canonical Adam's apple area, if you will. Here's the cricoid cartilage kind of coming down, and then the ligaments that are attaching it. And so I want to take a minute. I want to take a special hot minute and say hello to this little tiny bone, and it is known as the hyoid. Right? It is awesome. And so I want you to take a look. So your jaw is actually descended from bones in the gills of a fish, essentially, to keep them open. And this is like no exception. So if you look at it, it actually looks like a tiny jaw, right? It even has these like protrusions, okay? And so this bone, the bones in your ear, the auditory ossicles, and your jaw as well are all former gill bones, right? Gill stabilizing bones. And so now we use them for other things like eating and chewing, or in this case, like making sound, or interpreting sound. So I just love that little bone. It is a great one. Okay, the hyoid ligament is, right at the position of the thyroid, and it specifically connects right onto the hyoid bone, right? So that connective tissue is flexible, right there. Uh, and right, that's pretty much most of what I want you to know for there. So there's 3 other types of cartilage that you'll see also. So you can, kind of put these are going to be connected with the larynx as well. Arytenoid cartilage is going to be in the back, right, of the thyroid position. Corniculate cartilages are going to be the ones that are kind of attached on the side like little horns. Okay. And then the cuneiform are the ones that are supporting the soft tissue between the arytenoids and the epiglottis, and they kind of have like a squarish shape. Okay, like an elongated squarish shape. And the 3 ligaments that are used to suspend the larynx from the hyoid is just the thiohyoid, cricotracheal, and the intrinsic ligaments. So the thiohyoid is going to be, you guessed it, supporting it from the hyoid bone. Tracheal is going to be suspending the trachea from the larynx. And so the trachea, again, crico, so you're thinking of like, those little ridges, those little like circle rings, right? The intrinsic ligaments themselves hold the laryngeal cartilages just kind of all together. They're like the duct tape of the whole structure. So the inside, let's talk about like the noisemakers, right? So there are folds that we're going to be looking at, and they are going to be paired with the vocal cords themselves. Let's see if I can get the picture up. Here we go. Okay, great. So these are going to be, this is looking down, right, into the trachea. So here are what we call like the vocal cords, right? And this is like when they're broad and open, they can actually come close together for different like sound, like modulated sound. So here's the top of the epiglottis itself. Remember, that's like the garbage can lid in the back where the glottis is. And so on the side of each one of these vocal cords is just like what we call the vestibular fold, if that makes sense. And I just wanted to kind of show that part. They're there. Okay, so the vestibular folds are not really playing a role in speech, but what they're doing is they're closing the larynx whilst you swallow. However, the inferior vocal cords are going to be the sound producers when air passes through them, right? So if they're, if they're kind of spread widely apart, for example, that's going to be like a deeper tone. And if you have them and they're like closer together, it's like a higher pitch, right? High pitch sound. Okay, great. And I think, oh, sorry. I think for the most part, that's what I wanted to get through for this. Right. Oh, let's talk about the action, just a little bit of the action itself. So there's like a couple of muscles. They're so tiny. They're so tiny. Okay, so they're called the cricoarterioid muscles, and they're the ones that are actually going to be doing a lot of that motion, and they're moving um, the arytenoid cartilage, right, and the corniculate cartilage, like open and close. Like, see, here's like an open, and here is like a closed formation, right? And here's the posterior portion of that cricoarterioid muscle, right? So here's like a tiny one, like little tiny biceps right here, right? Little tiny muscles. And they're just manipulating um, these two cartilaginous like here, let me just get rid of it. Okay, these two cartilaginous doors swinging open and close. And when the doors swing open, it also pulls the vocal cords open, which gives you that deeper tone. And when the doors swing closed, then that's when we have that closed higher pitch, right? So that would be the adduction is the higher pitch, and the abduction is going to be a lower pitch sound. Okay, right. All right, let's get into the trachea next. But for now, I think that's it. And oh, I'm so sorry. I hope you're having a great day. Bye.